All right, so often patients are asking, what type of anesthesia will I be under with cosmetic surgery? So I'm going to talk to you about the most complicated types of anesthesia and then the simplest, most holistic form of anesthesia, which is the type that I use. So the most complicated one, which is the traditional way of doing anesthesia for cosmetic surgery, is general anesthesia. So that's where you're put to sleep, you're intubated with a tube, and that breathes for you. So your body is paralyzed. They give you things that help your circulation go while you're sleeping, and then they can do their surgery. Now, sometimes the surgeons will use tumescence and sometimes not. If they don't, you'll have more bleeding and more post-op pain. You may have drains hanging out of you after your tummy tucks and your breast lifts and facelifts. If they use tumescence, you may not need those drains because your bleeding will be less. Also, you'll have different anesthesia pain medications afterwards because you may have more pain. Now, the next level of anesthesia would be just an IV sedation. You may still need oxygen for that one, and they do put compression hose on your legs for circulation. So that one, you do still need oxygen because you will be asleep. The next version is the type which we use in our office, which is fully tumescence. So tumescence is like this big local anesthesia. And so basically the area I'm working on is the only area that needs to be numbed. So people are sleeping, sometimes they're chatting with me, but they usually fall asleep in mid-sentence while we're kind of doing the procedure. Occasionally they wake up and we have a little joke and then they go back to sleep. But you get medications by mouth ahead before we even do the surgery that help you relax. And then during the procedure, we use this tumescence, this big anesthesia. So that anesthesia is all local anesthesia. So we're numbing the areas we're working on. It has something in it called epinephrine, so that helps prevent the bleeding. So we don't need those big dangly drains for our tummy tucks. We don't need the drains for our breast lifts, breast dogs, facelifts, things like that. We just don't have that bleeding, which is nice because then you don't feel fatigued, like you can with some of the other traditional ways of doing anesthesia. The other nice thing about tumescence is it stays with you. So literally when you get off the table, you're still comfortable. So you go home, eventually, gradually over time, that anesthesia wears off, and then you can take some medicines by mouth to help you stay comfortable. The majority of my patients transition to Tylenol and ibuprofen within a couple of days because that tumescence stays with you and keeps you more comfortable. So I'm happy to talk about it more with you and help you figure out your surgical cosmetic surgery needs. Thank you.